Hi, I'm Doctor I am sorry. Yes, you heard me right. That's my name, and soon you will find out why. The following program is based on my own personal experiences during different patient encounters. So enjoy the show. How many we have today?
Good morning, Dr. Sori.
Good morning, Nurse Morphine.
I'm sorry for you, Dr. Sori, but it's going to be a busy day.
What the 30? I have 30 patients scheduled for today?
Yes, my dear. That gives you exactly 15 minutes per patient if you choose not to take a lunch piece or sheet break. If you do, then your time will be further reduced.
Well, I guess this leaves me with no choice. I won't give take a shit break then.
Good choice, Dr. Sori. Out of those 15 minutes, you'll be spending half the time documenting electronic medical record. Your actual patient-doctor bonding time is no longer the 7 to 10 minutes. All the best!
But that doesn't provide any good quality care to my patients. I didn't sign up for this shit.
Oh, just you did when you took the oath of Hippocrates.
Seems more like an oath of hypocrisy to me.
Well, the company wants you to make the most amount of money. And the government wants you to see as many patients as possible while providing them with the best quality care with minimum reimbursements until you fall dead.
I see. But is there a way to fix this?
Those who suffer the most under this type of setup is the doctors and the patients. So who gives a fuck? Go get your ass in there to get your first patient.
Fine. And who's that?
It's Mrs. Have-It-All.
Miss Have It All. Not again!
Come on, she's coming back after 3 months. Before that, she couldn't even get an appointment. I'm sure she have a lot to talk about. It's a great warm-up for the rest of your day. Don't give me that shit face like that. Smile. All the patients, they love this.
Doctor, sorry. Am I glad to see you?
I'm sure you are. So, what brought you in today?
Well, I have a bunch of problems I want to talk to you about. First of all, I have headaches that
Doctors, they have one eye on the clock and one on the patient.
they start throbbing on my right side, and when they come even the slightest light or sound, I struggled for 3 months to get an appointment of hardly 15 minutes. I took the day off from work, waited for the doctor to see me, and even that time is not uninterrupted.
I'm sorry for that. Please go ahead.
My headache is...
I'm so sorry. I have to take this. This is from the hospital. Hello, this is Dr. I am sorry. Yes? So you're calling me to tell me that my patient is constipated? Okay. Let's give him some stool softeners then. Let's try some laxatives if that doesn't work. Then shove up him up his ass if he can't go. God damn it. I'm so sorry. You were saying something?
Yes. So, my headache is usually on the right side.
Yes.
Dr. Sori, You better hurry. We have a patient in the next room and he seems very sick.
That does it.
Please, Miss Havidal. Oh, I'm so sorry, Miss Havidal. Please don't leave.
No, I can't take this anymore.
I beg you, please. Miss Fairview, please. What the fuck am I supposed to do if everyone wants a piece of me at the same time?
So my headache is usually on the right side of my head, throbbing. And when it comes, even the slightest light or sound bothers me.
Well, I think you have migraine headaches. So, this is the prescription for your headache medication. Start using it from today, and we will see you next time.
But what if it's a brain tumor?
I don't think so at this time.
How can you say that with so much confidence? You hardly listen to me.
How can you say with so much confidence that it's a brain tumor?
I Googled it, and I realized that I have all the symptoms.
Dr. Google, our biggest competitor. That son of a... Okay, let's not chase the zebras over here.
What do zebras have anything to do with it?
I mean, let's focus on more common things rather than jumping to the less likely conclusions.
But if something does happen to me, you do know this guy, right?
Oh, Mr. Lawsuit. Of course, every doctor knows him. So let me see. It seems like you have a pretty good insurance, so why not take advantage of that? Let's order multi-$1,000 workup for a brain tumor diagnosed by Dr. Google. I would order an MRI brain, CT brain. Did Dr. Google recommend anything else?
What about my back pain, my chest pain, my abdominal pain?
I'll order a CT chest, CT abdomen, CT pelvis. You know what? Let's order a total body scan.
That will be awesome.
Great! So I'll see you in your next visit, and I'll make sure that it's not too far apart this time.
Does this medicine have any side effects?
Yes, in case you start experiencing any chest pain, shortness of breath, nausea, vomiting, diarrhea, constipation, headache, lightheadedness, blurriness of vision, fever, chills, rigors, dysuria, hematuria, hematochezia, melena, hematemesis, abdominal pain, or rectal bleeding, then please contact your doctor.
But you are my f***ing doctor who's hardly available to discuss anything.
I guess I am. Trust me, I promise to spend more time with you in your next appointment.
But
Thank you very much.
this doctor.
Another rough day at your face. Hey, don't forget to give us good reviews online. Hey, what about the copay?
There goes my reputation. You must be thinking, then do not schedule so many patients on the same day. But we have to meet our bottom line, pay our staff, our student loans, malpractice. And since the government and the general people think that we make shitload of money, we fall under higher tax brackets. A lot of doctors are going out of business nowadays. To keep our doors open, we have to see as many patients as possible. And that's what ends up happening, a hamster wheel. Now, with the Affordable Care Act in place, more and more patients with a slew of problems are pouring into our system, and there aren't enough doctors to see them. The reimbursements are constantly going low and are also based on patient satisfaction. With such a short time spent with our patients, what sort of satisfaction and care are you expecting? In short, the American dream for physicians is over.